This video is for you if you are currently experiencing peripheral neuropathy, also sometimes just called neuropathy, or if you have cancer and are or will be undergoing chemotherapy, and some immunotherapy drugs can do it too, because there is a likely chance you could get peripheral neuropathy. And the natural treatments I'm about to share with you not only treat it, but can prevent it from happening in the first place. This video is also for you if you know someone struggling with this unpleasant side effect, because you may be able to help them in a way that most doctors can't. And that's just because they're not educated on these naturopathic treatments. So not only am I going to be sharing with you specific supplements for specific drugs, as well as more general things, but I'll be sharing topicals and I'll be sharing other modalities as well that can be very, very, very helpful. So stick around. And hi, I'm Dr. Lisa Matejka. I'm a naturopathic physician, energy worker, and transformational life coach. You could call me a cancer transformation guide. And I do help those with cancer navigate their journey back to health and wellness, but to an even better state than before, physically, mentally, emotionally, energetically, and spiritually, by awakening their own innate healing powers with compassionate guidance and loving support. And so, for those of you that may not know, peripheral neuropathy, oftentimes just called neuropathy, is basically nerve damage, and it can present like numbness and tingling, loss of sensation, to nerve pain, to weakness. So all sorts of things can happen when the nerve is damaged. And yes, this can happen as a common side effect of chemo, especially certain particular chemo drugs, which I'll get into, certain immunotherapy drugs. But it's not just chemo. It can happen from other drugs, HIV drugs, alcoholism, other toxins, nutrient deficiencies, and metabolic disorders such as diabetes. So there's a few things that can cause neuropathy, but this video is mostly centered around neuropathy that comes from the conventional treatment of cancer. So, do you know which drugs you are on or will be on? You can pause this video if you want to get that information, because at the end, because I'm going to go general to specific, I will be sharing which sorts of things work well for which specific types of chemo and one immunotherapy drug, but there's lots of immunotherapy that can have this side effect as well. Now, here's my brief cautionary tale or disclaimer, if you will. It really is best if you have a naturopathic doctor or naturopath or some sort of holistic doctor or healer of your own that's familiar with what I'm talking about. Because the idea is, yes, I'm going to tell you some things that can be very helpful for you. But because I'm not your personal doctor, I don't know if it is actually appropriate for you specifically, depending on your whole health picture and all of that stuff, which is why it's best if you have a professional, a holistic professional of your own, just to, verify and be sure, like, oh yes, this is safe and effective for you. I hope that makes sense. For example, vitamin E is something that could be helpful, mixed tocopherols, but those are dangerous to take if you are on blood thinners. So these are the things, take what I say, but then double check that it is safe and effective for you. And I will be mentioning doses. I usually don't like to say doses because, again, those can vary from person to person. But I'm not going to say what dose you should take. I am going to say what dose has been found to be effective in research studies on adult participants. So take that for what you will. And yeah, it varies. I'm in the US, it varies state to state. You can still find naturopaths and naturopathic doctors no matter what state you're in. It's just different what they can say. Different countries are also different. There's some sort of holistic professional that should be able to be found, if not near where you are because you're in a rural area or something like that. There's a lot of people that do telemedicine and virtual visits these days. So no matter where you are, you should be able to find somebody. And because also you want to, I mean, and hopefully your oncologist would be doing this anyway, because yes, it's easy to assume like, oh, you have these neuropathy nerve issues after starting chemo. It's probably that, and it probably is, but it's also good to rule out other causes. So that's why getting nutrient panels, because also a lot of those nutrients that can cause neuropathy are depleted with those therapies. So getting nutrient panels, looking at labs, making sure your blood sugar is regulated, your thyroid is regulated, because that can cause some of these symptoms too sometimes. So anyways, but let's move on. So in fact, we will get right into some exciting stuff. If I had to choose my top 5, and I'll be talking about much more than my top 5, but broad strokes, again, these may or may not be right for you, and it does depend what drug you're on and your health picture, yada, yada, yada. But if I had to choose sort of a general top 5 for peripheral neuropathy, I believe I would choose alpha-lipoic acid, acetyl L-carnitine, methylcobalamin, which is B12, glutathione or N-acetylcysteine, depending on the form, glutathione if IV or N-acetylcysteine if oral, and topical capsaicin. I would say those are my top 5. So what the hell did I just say? So the first one, and these are in no particular order, alpha-lipoic acid. What is that anyway? Yeah. Think of it as something really similar to a vitamin. It's not technically classified as a vitamin, but it's similar. It's an antioxidant. And alpha-lipoic acid, yeah, it's an antioxidant. So it helps to relieve the oxidative stress that is caused by something like chemotherapy. And it can actually repair the nerve. Not all the supplements I'm going to say repair the nerve, but this one can do that. And the dosage found helpful in studies is 600 milligrams a day. And a little bit of caution about this is you want to take it with food. If you don't take it with food, especially a hearty meal is actually better. If you don't take it with a good enough meal, you might get some indigestion, some heartburn, some nausea. And if you're really sensitive to that and that's still happening even with taking it with food, there's a form called R-lipoic acid, which is much easier tolerated and still has pretty much all the beneficial effects. And oh, just another slight word here. If you do get another, say, naturopathic doctor or holistic health professional, and they say, yeah, you shouldn't take that, it's an antioxidant, and you shouldn't take antioxidants with chemotherapy, which is a lot of things oncologists say, just know that that actually is a myth, and it has been proven in studies that it's not a problem. But if for whatever reason you want to be extra, extra cautious, some practitioners and will still recommend you at least take it, the alpha-lipoic acid, the day of, during, and after chemo, but not the rest of the time, just so there's not as many interactions. But personally, I don't think you need to worry about that. So anyway, alpha-lipoic acid is one of them. Acetyl L-carnitine is the next. What even is that? It's basically a type of amino acid. It's an acetylated ester of an amino acid. So, we have like 22 or so amino acids that make up us. They're building blocks of proteins. So they're the building blocks of proteins, and there's about 22 that are relevant for humans, but there's like 500 found in nature. Anyway, it's basically a form of an amino acid, acetyl L-carnitine. It's been shown to be very helpful. It also can actually repair the nerve. And the dose that has been found helpful in studies is a much higher dose. It's like, and you don't necessarily even have to take this high of a dose, but the studies I'm referring to anyway, where it's been found really helpful, was a gram 3 times a day for 8 weeks. So at least it's temporary. A gram 3 times a day for 8 weeks. Oh, and if you're If you happen to be seeing a naturopath that does IV therapy, or you're in some sort of integrative treatment center that does IV therapy, there is an IV form of the acetyl L-carnitine, which just works faster, as well as intramuscular, but you can take it oral. So yeah, the dose I gave was oral, but it's also can find it IV or intramuscular. And glutathione or NAC, I'm lumping those together because essentially N-acetylcysteine, which is also a form of amino acid, will turn into glutathione in the body. So glutathione, if you're getting that one, that would be IV. If you're doing just oral supplementation, taking by mouth, then get N-acetylcysteine. And this is also an antioxidant and works to actually repair the nerve by scavenging the free radicals that are created with a toxic therapy like chemotherapy. So that's another good one. And topical capsaicin. So it's good to do something. I would say it's whatever your protocol or whatever you decide to try for this neuropathy issue you have or are trying to prevent. Definitely do, if you're just trying to prevent oral, like supplementation is all you have to do. If you currently have it and are treating it, I would also throw in a topical and maybe some of the other modalities I'll be speaking of. But capsaicin is from like cayenne, and it's a cream that you can find other versions, but it's oftentimes a cream. You can find it in a lot of just regular drugstores. And how it works, it's not that you need to necessarily get into this biochemistry, but it stimulates afferent C fibers, which release substance P, which is a neuropeptide that is an analgesic. So that's basically what this does, is it is a pain reliever. So it can actually just help the sensation. So it doesn't actually repair the nerve like the other ones I mentioned so far, but it does help with the pain and the weird sensations you might be feeling. It can just sort of help that feel more normal. And B12, and you want the methylated version, methylcobalamin, that can be helpful. It's common whenever there's a nerve issue, take B12. That's like a naturopathic go-to. Oh, a nerve issue, take B12. And typically that's because when B12 is depleted, you can get these symptoms. And but this is when you might want to check with your holistic professional, because yes, B12 can oftentimes be depleted and cause nerve issues, and it can, the depletion can further with these therapies. But also with certain cancers, you can actually have an excess of B12, and that excess of B12 can be bad for the cancer. So there are instances where you would not want to take a supplement of B12. So check with your integrative naturopathic professional. But definitely that can be helpful in neuropathy. Okay, so I'm going to tell you some other supplements that can be really helpful. Not my top 5, but still really good and validated in research studies. All the ones I'm about to say have also been validated in research studies. So we have vitamin E, vitamin B6, also known as pyridoxine, vitamin B9, also known as folate, omega-3s and omega-6s, taurine, glycine, myo-inositol, and St. John's wort. So why? So vitamin E, B6, aka pyridoxine, B9, aka folate, basically the same reason as the B12, methylcobalamin. As well as the omegas 3s and 6s, when any of those are depleted, it can cause nerve issues, neuropathy. So that's why those can be helpful. And again, therapies like chemo. And when I say chemo, I'm actually also referring to immunotherapy, because a lot of immunotherapy drugs these days can also cause peripheral neuropathy. But yes, these drugs can potentially deplete some of these nutrients, or just in general, if they're depleted for whatever reason, can lead to the neuropathy. So that's why those can be helpful. And the omega-3s also play a particularly essential role in nerve function and blood flow. So it's always good to have omega-3s for nerve and brain function, heart, skin, all kinds of things. But anyway, I get ahead of myself. Myo-inositol is good for the nerve cell membrane support. Taurine is an amino acid, but it acts as an inhibitory neurotransmitter, inhibiting pain perception, so it's good for pain. Glycine is also a amino acid, but what it does is it inhibits advanced glycation end products, which damage the nerve, so it kind of helps nerves to not be damaged. St. John's wort. Now we're talking oral, and studies, oral supplementation of St. John's wort has basically just showed it helps with pain. It improved overall pain scores. Now you can also use it topically if you find a St. John's wort oil, which is not easy to find in stores, but if you know herbalists or herbal places, that actually is also good for nerve pain. But the studies I know of, we're talking oral. Okay, so now I'm going to tell you more topicals that can be very effective that are also validated by research studies. By the way, I say validated by research studies, they also work in actual people because I've used these in actual people as well. Okay, so I had already talked about the capsaicin cream, but also really up there, maybe even tied with the capsaicin cream, is geranium oil. Yes, the beautiful geranium flower. Geranium oil has been shown to be highly significant when compared to placebo in studies, and it's very anti-inflammatory, most renowned for its inhibiting the pro-inflammatory T cells. And then curcumin, if you can find a curcumin oil or cream, also is very anti-inflammatory, inhibiting mostly TNF alpha, interleukin 1 beta, and has shown helpful with neuropathy as well. And then there's DMSO. And DMSO is known for being really good to put on your skin basically before anything else you want put on your skin, because it really helps drive it into the skin. That's what it does. It almost like creates this pathway so that whatever you put on after, it really gets into the skin. So that's one reason why it's good to do, and it does this without damaging the membranes. But in and of itself, DMSO is anti-inflammatory and analgesic, so it has a bit of a pain relieving property as well. And interesting thing about DMSO, which by the way, I'll just put on the screen what exactly it is because it's a long word. But an interesting thing about it is if you use enough of it, you may get a strong garlic taste in your mouth. And that is because you are exhaling a metabolite of it, dimethyl sulfide. And because yes, it does get into your skin, your cells, your bloodstream, and can be exhaled through your breath. Isn't that interesting? Okay, so now I'm going to tell you some other modalities that can be really helpful for neuropathy. And these are also validated by research studies. So we have acupuncture, magnetic therapy, specifically pulsed electromagnetic fields, and yoga. And I am going to give you a dose for these that was used in the research studies. So, acupuncture was found to be helpful when done twice weekly for 5 weeks. Yoga was found to be helpful when done 30 to 40 minutes daily for 40 days. Now, just a little side note here, acupuncture and yoga, of course, have way more benefits than just peripheral neuropathy. So if you were doing these things and at this dose, this frequency, it's worth it for many other reasons. Just your overall quality of life will improve. I mean, all the other side effects will probably be lessened. I mean, so it's worth it I would say, worth it to put in the time for those. And then the other one is the pulsed electromagnetic fields. I guess there's no real point of me giving you the dose because unless you're a practitioner yourself, you're going to have to find a practitioner who does this. The frequency, though, I'll say, well, the actual frequency is 30 hertz at 20 Gauss, but no, the frequency as in the consistency that you should do it is basically daily with taking weekends off. So like 5 days a week, and that's an hour session each time. So that's a lot. This also has more benefits than just the peripheral neuropathy. I had mentioned in another video, the pulse electromagnetic fields actually target cancer stem cells. So that is the main reason you should be interested in doing the pulse electromagnetic field, the PEMP therapy, but it also is good for side effects such as this. And because otherwise, yeah, going an hour a day, most days of the week, I mean, that's a lot when you're already going through treatment and appointments. So it's really, so something like this would be reserved for people that are so bothered by the side effect that it's worth it to them, except for the fact that I think it's worth it for all of you for that simple fact that it does target the cancer stem cells too. So I shared with you my top 5. Then I went into some others that's validated by research. Now I'm going to go into others that I specifically learned from other naturopaths that have been helpful for them. The other things I've used and found helpful, I haven't necessarily used the following, but I've heard from other naturopathic doctors that they've been very helpful in their patients. So we have, for supplements, we have undas, UNDA. For those that don't know, undas are essentially homeopathic formulations. They come in numbers. So undas 2, 9, and 42. And it's best if you do take all 3. Undas 2, 9, and 42 can be very helpful. Zinc can apparently be helpful, especially if it's like if it's a mouth type of neuropathy. Zinc can be helpful. And zinc is typically helpful in diabetic neuropathy, but yeah, I guess it can also be helpful with oral neuropathy. And for topicals, evening primrose oil. If the other things fail, these are things you can give a try. Evening primrose oil or Epsom salt baths. Those are nice to take anyways, and a lot of people have Epsom salt. So try an Epsom salt bath perhaps. And then for other modalities that can be helpful, so for immediate relief of nerve tingling, low-level laser therapy, also known as cold laser, can be very helpful for just immediate nerve relief. And so where would you find this therapy? Good question. Perhaps a medical spa. Now, lasers are often used in like aesthetics, but those people may not be trained to use them for this. So perhaps something more like a medical spa, chiropractors, naturopathic doctors. I mean, all kinds of alternative practitioners may be able to use a laser. So I guess check what your area has. But yes, cold laser, low-level laser for like immediate relief of nerve stuff. And you would do this a couple times a week. And it also is good for preventing lymphedema. So like lymph fluid that can accumulate, which is very common in cancer. It can prevent that, and it can also prevent cording, which is also like due to lack of lymph flow. So it can be a good thing. And some people will say, yeah, I shouldn't use the laser in people with cancer, but it's been done a lot, and it's mostly just you want to not use it over an active tumor. That you don't want to do. But if you find a practitioner, they hopefully will know what they're doing. And injections of dextrose near the nerve can help with nerve pain. And again, if you're going to do something like injections, a lot of times these injections are done by DOs, doctors of osteopathy, chiropractors, naturopathic doctors. So for low back pain specifically, trigger point injections, and also combined with electrical stimulation and hot and cold contrast baths. So these are just some options that are available that have been found to be helpful. Massage is another one. Maybe just getting a regular massage. Not only can that help you relax, but that can help with this too. And really, this is important. Let's not neglect the foundations of health. That matters too, because if your foundation is shaky, it can all come crumbling down. So things like whole food, healthy diet, including probiotics, good water, movement, a little bit of exercise. That stuff does matter too. And then some common sense things which you may not have had to think about before, but now you do, like good shoes, wide toe boxes, no heels, nice, good, comfy shoes, padding for your knees if you have to kneel, like if you garden or whatever, and good chairs, because a bad chair is not going to help if you got some neuropathy going on in your legs. So things like that are just, extra things to be cognizant about. Okay. So now we're going to get into some specifics. So if you are on any of the chemotherapy drugs I'm going to mention, or will be on any of the chemotherapy drugs I'm about to mention, then there's a good chance you have or will have possibly a neuropathy. So, and I'm just saying that because, not to manifest anything negative for you, because it might be just a good idea to then try some of the supplements and some of the things I had mentioned as a prevention, because then we can prevent it from happening in the first place. So if you're on or will be on the following, there's just a higher likelihood for peripheral neuropathy. So the platinum-based drugs, that's cisplatin and its analogs, carboplatin, oxaliplatin, 5-FU, that's 5-fluorouracil, the vinca alkaloids, vincristine, vinblastine, the taxoids, paclitaxel, docetaxel, gemcitabine, cytarabine, ifosfamide, misonidazole, did I say cytarabine? 5-AZA, 5-azacitidine. Let's see, what else do we have? Hexamethylmelamine, Suramin, VM26. And if I didn't say the chemo you are or will be taking, then yay! But there's still a chance you can get it, because this is not an exhaustive list. It's just the most common ones. And it might not even be updated to the very newest ones. And then I had mentioned a lot of the immunotherapy drugs can do this as well, such as bortezomib. I always have a hard time saying the immunotherapy drugs. Bortezomib, a bunch others. So, and we will go over some specific things to take for some of these. So, if you happen to be on bortezomib, the immunotherapy drug, and what I'm about to say can be helpful for other immunotherapy drugs too, but I'm specifically saying bortezomib because this was the drug in the study, and the dosages I'm giving are the dosages used in the study. So we have 400 milligrams of DHA, which is a part of omega-3, 600 milligrams of alpha-lipoic acid, 60 milligrams of vitamin C, 10 milligrams of vitamin E, and that's for 6 months. And then paclitaxel, you would want to take L-glutamine and acetyl L-carnitine as priorities. Okay, and in case I haven't made this clear, yes, all these are based on studies as well as my own experience. So, in general, for platinum-based chemo drugs, a good rule of thumb is to take vitamin E, acetyl L-carnitine, and an NAC if you're just doing oral, or glutathione if you have access to IV glutathione. Now, to get into specific, which ones are really priorities for which specific drug? So cisplatin, if you're on cisplatin, definitely vitamin E, because cisplatin can deplete vitamin E, and acetyl L-carnitine. If you're on carboplatin, vitamin E is the priority. If you're on oxaliplatin, the priority is gonna be glutathione or NAC. Remember, glutathione if IV and acetylcysteine if oral. Now, oxaliplatin is interesting. I have a couple more studies to talk about that. One study showed that if you're on oxaliplatin, you should take ice chips, put ice chips in your mouth while being infused with the chemo, and this can prevent an oral neuropathy, specifically oral thermal hyperalgesia, because you can get really sensitive to temperatures and things like that. So having ice chips in your mouth during the chemo acts as a sort of oral cryotherapy. And then there's another study that studied a very specific supplement protocol. Actually, there was acupuncture in it as well. Studied a very specific supplement and acupuncture protocol for those patients on oxaliplatin, and it was shown to be very beneficial. So I'm going to tell you exactly what this is. Now, I've actually never personally used this with my patients. It's a pretty intense protocol. I've never really had to, but if you are struggling and nothing seems to be working, I mean, you might want to give this a try, or this might be one of your first go-tos actually, if you're on oxaliplatin, since it is validated by research. So here's what it is. By the way, the study on the other protocol for oxaliplatin is good for both prevention as well as treatment. So during the actual treatment, on days 1 to 7 of the oxaliplatin infusion, you would do 15 grams of L-glutamine twice daily or 10 grams 3 times daily of L-glutamine. So basically, it's 30 grams a day of L-glutamine, but you can space that either into 2 or 3 sections. And also a liquid calcium magnesium supplement, a 1-to-1, half calcium, half magnesium, and taking 500 milligrams of that at night. And this specifically helps with the temperature intolerance. And then after the treatment, you would do either alpha-lipoic acid, 600 milligrams, 3 times daily with meals, or R-lipoic acid, 300 milligrams, 3 times daily with meals. And mixed tocopherols, which is vitamin E, but you want the version that's mixed tocopherols at 100 milligrams or 500 IU. It's the same, 100 milligrams equals 500 IU, 3 times daily as well. And lion's mane mushroom, that's a new one we haven't heard today. Lion's mane mushroom hot water extract, equaling approximately 1,000 milligrams, taken twice daily away from food. And then when it comes to the acupuncture, they did list 11 specific points that were used that I'm just not going to mention here. I'll put them up on the screen if you are interested. Here they are. So yeah, and I'm just gonna place on the screen a little chart there for you. I don't actually know if that's helpful because it's made for clinicians. Ooh, you guys get a sneak peek into something made for clinicians. And these are based on the studies and refers to the number of people in the study, but that can kind of give you an idea of what's good for what and some doses used in the studies. These are all ones that were statistically significant, helpful. And yeah, so that was a lot of information. So what to do with all of it? Well, my recommendations, number 1, do work with a professional, somebody like me that can really guide you as to which would be safe and effective for you. But otherwise, if you're on one of those specific chemo drugs I mentioned that did have specific priority supplements, I would start there. And of course, heed my top 5. And really a good naturopathic go-to is alpha-lipoic acid, acetyl L-carnitine, and N-acetylcysteine, because all 3 of those will repair the nerve itself. And then add in a topical like capsaicin cream, which is easy to find at most stores. Geranium oil is a great one, but a little harder to find. And then if you add in something like acupuncture or pulse electromagnetic fields, woo, you got a powerful combo. And I might, I don't know, I was going to say I might suggest the pulse electromagnetic fields because they target the cancer stem cells too. So that's a big double whammy, but acupuncture is also a really nice therapy that has a lot of benefits as well. So adding in, yeah, like a combination of supplements, topicals, another modality is going to be very powerful. And yeah, what else? I would say if you would like to check out my description, check out what's in my description box. I got links to find out all sorts of cool stuff about me and get a free gift for you. And if you can, please like and follow so that I can help more people with this information. Otherwise, yeah, I hope you found this helpful. And I hope if you are suffering with peripheral neuropathy, you get better. It does get better with time. Nerves do repair. These things will just help it faster. So, best to you wherever you are on your journey, and so much love.